My name is Godwin Kasongo and I'm going to take you through leukemia medicine. I'll take you through the pathophysiology, the predisposing factors, and the definition, since the cause of this condition, leukemia, is idiopathic. Leukemia is the malignant of blood which is characterized by hyperplasia of white blood cells and their precursors. Precursors is just the origin of something, in this case the origin of white blood cells. Hyperplasia, the uncontrolled multiplication of white blood cells. That is what is termed as leukemia. We go to the predisposing factors. Since the cause is unknown, we have genetics. Leukemia has a tendency of running in families. It has a tendency of running in families, and therefore, if one is down to leukemia, then it will keep on running from one generation to another because it is hereditary. We go to another predisposing factor, that is viruses. Viruses such as human T-cell leukemia virus 1 have a tendency of causing leukemia. We know that viruses have a tendency of replicating and destroying cells once they invade. Due to that, when this virus invades one, they're going to destroy cells and cells become leukemic. As a result, those cells, they will start multiplying, which in turn will lead to leukemia. Also have chemotherapy as a predisposing factor. The use of chemical in the treatment of cancer. Chemicals such as formaldehyde, a carcinogen. A carcinogen is defined as follows: a substance which has a tendency of causing cancer. We defined earlier leukemia as the malignant of blood. Malignant and cancer are one and the same. So this chemical formaldehyde, it causes leukemia. Not only that, the use of cytotoxic drugs such as vincristine in the treatment of cancer, it also predisposes one to have leukemia. Also have congenital abnormalities such as Down syndrome, a condition in which one has an extra chromosome. We also have radiation such as UV rays, ultraviolet rays, and prolonged exposure to sunlight. This leads to what? Gene mutation, and also destroys cells. We now go to the pathophysiology, how this leukemia comes about. All cells develop from the pluripotent stem cell in the bone marrow. The stem cell has a tendency of dividing into specialized cells. We have the myeloid stem cell and the lymphoid stem cell, which further divides into specialized cells such as thrombocytes, which are also known as platelets, erythrocytes, which are also known as red blood cells, leukocytes, which are also known as white blood cells. They all develop from the pluripotent stem cell in the bone marrow. We define leukemia as a condition characterized by hyperplasia, meaning there will be an uncontrolled maturation and proliferation of white blood cells in the bone marrow, and this will lead to lack of platelets and white blood cells, because there will be no room for red blood cells and platelets due to the hyperplasia which takes place in this condition known as leukemia. As a result, there will be anemia, which is the condition characterized by the lack of red blood cells, and there will be also bleeding, which will come as a result of lacking of the clotting mechanism, which is done by the what? By the blood platelets. Under normal circumstances, blood cells develop there are certain factors that favors maturation and the proliferation of blood cells in the bone marrow. But in this case, due to the fact that cells are leukemic, they are affected, they are malignant, there will be hyperplasia of white blood cells. Cells will be affected. They will be affected in such a way that they will be disabled, they will be unable to perform their specialized functions due to the fact that they are affected. They are affected with the malignant, with malignance. We've come to the end of the lesson. Stay blessed.